Hello friends, this is your one and only bodybuilding doctor, Dr. Nikhil Tari. So this is our third episode of steroid use in bodybuilding. Today we are going to talk about the side effects. Topic is a bit lengthy, it can be very difficult for few people to understand. So I request you at least go through the video 3 to 4 times so that you can understand it very properly. Okay, so let's go for it. Hello again. So, side effects. Frequently asked questions regarding side effects. First, are they bound to happen? Yes, they do happen. Are they deadly? Yes, they can be deadly. Can they be avoided? Yes, they can be avoided. Are they permanent? Depends. Depends about which side effect we are talking. And do we get the treatment or time or not? That depends that will that side effect last permanently or temporarily. Okay. So there are a lot many side effects. I will just cover the important things to make it simple and easier. First, acne. Acne means pimples you get on your face, the boils on your chest, upper back, lower back. This is because of the DHT hormone. When you take synthetic testosterone in your body, it gets converted into dihydrotestosterone, which can lead to acne. Second, hair loss and hair gain. These are two different things. Hair loss, you lose your hair from your scalp, and hair gain, you get lot of hair on your body. Gynecomastia. Gynecomastia, very common thing because of high estrogen levels during and after the cycle, which gives you like female pattern breast in men's. Yeah, man boobs. Okay, because of high estrogen, you can get man boobs. Libido loss, sex drive low. Very common. Very common. Almost every other client is having this side effect. This can be avoided if you give the proper treatment, and it can be recovered also. It will take some time, but recovery is 100%. Liver damage. Lot many steroids, orals as well as injectables, are liver toxic. They can cause cirrhosis of liver and they can cause deadly liver damage. Renal kidney damage. Whatever steroids you take, they are excreted by your kidneys, by the urine. So those are all toxic to the kidneys. Cardiac issues. Lot many cardiac issues are there. Your heart gets enlarged. The muscles of the heart are not that elastic, so they don't pump properly. Your blood vessels get enlarged and thick. Your blood pressure will be high. Your blood will be thickened. So a lot many complications can happen during a steroid cycle and after a steroid cycle. Aggression and mood swings. Due to high androgen levels in the body, the guys are very aggressive. They are like ready to fight anytime. But it depends where you get your aggression out. In your home, with your friends, or in the gym. And mood swings. Yeah, mood swings do happen. After the cycle, you may feel happy sometimes, you may feel low sometimes. Testicular shrinkage. Testicular shrinkage is also a common thing. It can be avoided very easily by ICG injection. Prostate enlargement. Prostate enlargement is again a DHT issue. Because of dihydrotestosterone, it can enlarge your prostate, which will cause you difficulty during urinations. So, but it can be treated. Yeah, if it's quite delayed in the treatment, then surgery is the option for the enlarged prostate. Edema. Edema means swelling on your body. It occurs because of imbalance between water and electrolytes. Arthritis. Because of high estrogen levels, your bone can get weak and you may have arthritis. Osteoarthritis and in some cases rheumatoid arthritis too. virilization and masculization. Women's, their voice changes, the voice seems like a man is talking, they get facial hair growth, they lose their hair from the scalp, they look manly. So in women's, masculization do happen. Gastrointestinal issues. Lot many gastrointestinal issues can be there. Hyperacidity, IBS, irritable bowel syndrome may also happen. Death, IV drugs. Death. There are lot many death cases are found on your social media every week. The death cases are rising because there is a lot of IV drugs involved nowadays, intravenous drugs. And other thing is, I have seen many of the drugs. The drug inside the bottle is different and the label printed on the bottle is totally different. So the guys don't know what they are injecting actually. And there's a trend now. You have to mix 5-6 injections together in one syringe and you take it IV. And see, such things that can happen and nothing can be done. Client or the man or the person who is taking that can die instantly. Now, so we are done with the measure of the side effects. All these side effects can be treated if the client comes to the doctors or to the medical professional on time, and this can be avoided if proper care is taken during the cycle and after the cycle. There are two things which I like to discuss which are very difficult for us to treat. The two things are depression and addiction. See, depression and addiction is a psychological thing. Steroids are very addictive, very addictive. I have used it myself, I know how addictive it is. You need a very strong mind to get out of it. Okay, so I'll just discuss how the client goes into depression and how the addiction occurs. Okay, first, cycle starts. Your client starts taking the cycle, he starts injecting the androgens and anabolics in his body. He finds gains in his body. Muscle is growing, he's losing fat, he's very confident, he's very aggressive, he's very manly, he's superhuman now. Then the cycle ends. When his cycle ends, his estrogen levels are high and his testosterone level goes down. Then what happens? He starts losing his muscle mass, he starts losing his strength, he starts losing his libido. So what happens when you are on cycle? There is high level of testosterone in your body, which helps you to hold on to large amount of muscle mass in your body. But when your cycle stops, that high level of testosterone is not maintained. It drops significantly. And so you lose your muscle, you lose your strength, and you lose your libido also. Now, many people will say, so we do PCT to recover. Yes, PCT. But even after PCT, your normal levels hormones and your cycle level hormones, there is a vast difference. If you see a normal person testosterone levels, it will be somewhere around 300, 400, maximum 500. And during cycle, if you see the same person's testosterone level, it will be 1500, 2000. So it's just like when you're on cycle, you're driving a Ferrari, and when you're on after the cycle, you're driving a old Fiat car. So you understand the difference. So what happens when he loses strength, his libido, he shrinks. He loses confidence. He starts losing his motivation. That leads to depression. Now how to come out of this depression? He starts missing those gains. He starts missing those strength, that power, that aggressiveness. So what he does, he goes for the other cycle. Again the same thing happens. Then again he is in depression, then he goes for the other cycle. And slowly and steadily, he goes very deep. And it becomes very difficult for us to bring him out of it. So, this is all about the side effects. It was a lengthy topic. Lot many things are there. Please go through it 3-4 times. Listen to it properly. If you have any questions, you can ask me. If you like this video, press a thumbs up. Do subscribe our channel. There is a lot more to come. Till then, Bye.